5 signs an elderly person may be in their final year, subtle warnings you shouldn't ignore. When a beloved individual in their advanced years begins to exhibit subtle yet discernible changes over the course of a year, it often prompts concern, even if the implications are not immediately apparent. Many harbor the misconception that the transition of life in old age occurs abruptly, an unforeseen event that strikes without prior indication. However, the profound reality is far more intricate. The human body, a remarkably complex system, frequently issues quiet, understated warnings, sometimes for many months, or even up to a full year, before life gently reaches its ultimate, final stage. The pervasive challenge lies in the fact that the vast majority of people, including close family members and caregivers, tend to overlook these crucial signs. This oversight happens precisely because these early indicators often seem inconsequential, minor, or easily attributable to the natural processes of aging. It is only in retrospect, when families look back with a heavy heart, that they recognize these subtle clues were indeed present all along, woven into the fabric of daily life. By then, however, the window of opportunity to truly prepare, to create deeply cherished last memories, or to provide specialized comfort has often irrevocably closed. This comprehensive discussion will illuminate 5 pivotal signs that frequently emerge approximately a year before an elderly individual's passing, aiming to empower you with knowledge and foresight. Some of these indicators might be things you have already observed but perhaps dismissed as merely a part of growing older. Others might represent nuanced shifts that, while seemingly minor on the surface, actually signal the body's gradual, inexorable decline. Recognizing these vital signs early bestows upon you the invaluable chance to offer superior care, to deeply cherish meaningful moments, and, most critically, to ensure that your loved one's final chapter of life is infused with an abundance of comfort, unwavering dignity, and profound peace. Understanding what is unfolding will prevent you from being caught off guard, allowing you to maximize the remaining precious time with those you hold dear. One of the earliest and arguably most telling indicators that a person may be approaching the final year of their life is a pattern of significant and unintentional weight loss. At its inception, this change might manifest so subtly that it goes unnoticed. Perhaps merely a belt that now requires an extra notch of tightening, clothing that appears conspicuously looser, or a once hearty, enthusiastic appetite that begins to wane imperceptibly. Many families, in their effort to rationalize these observations, often dismiss such changes as simply an inherent, unavoidable aspect of getting older. Yet the truth is a stark reminder. Losing a substantial amount of weight without any deliberate effort or dietary changes is rarely, if ever, a benign sign. This persistent weight reduction frequently signals that the body is no longer efficiently absorbing essential nutrients from food, that vital muscle mass is diminishing at an accelerated rate, and that the body's fundamental systems are gradually decelerating. While it is true that aging naturally entails some degree of muscle loss, particularly sarcopenia, when this process occurs too rapidly or becomes pronounced, it serves as a powerful red flag, indicating that a deeper, more profound physiological shift is taking place. The body may be encountering increasing difficulty in properly digesting food, or the individual might no longer possess the capacity to effectively process proteins, leading directly to noticeable muscle wasting. This resultant loss of physical strength does not merely render movement more arduous. It dramatically escalates the risk of debilitating falls, profoundly weakens the body's immune system, and leaves the person critically vulnerable to a wide array of infections. Another significant contributor to weight loss in the final year of life stems from fundamental alterations in appetite. Many elderly individuals begin to experience a marked decrease in hunger, a sensation that simply doesn't manifest with the same intensity or frequency as it once did. Their sense of taste may progressively fade, rendering even previously enjoyed foods unappealing, and they might begin habitually skipping meals or consuming considerably smaller portions than usual. This shift is far from a mere matter of preference. It represents a deep-seated physiological transformation. As the body intrinsically senses that it is commencing a process of gradual shutdown, it no longer signals the brain to actively seek food as often, nor does it derive the same metabolic benefit from consumption. The cumulative result of this reduced intake is a noticeable decrease in energy levels, a further decline in physical strength, and an overall gradual deterioration in general health and vitality. Furthermore, the insidious role of underlying medical conditions cannot be overstated. Unintentional weight loss is a recognized symptom of numerous chronic diseases, including various forms of cancer, congestive heart failure, or advanced kidney disease, all of which can progress silently and significantly long before more overt symptoms become alarmingly apparent. Even debilitating conditions like clinical depression or various forms of cognitive decline can lead directly to reduced eating, initiating a perilous downward spiral where the body simply fails to receive adequate fuel to sustain its most basic functions. Some well-meaning families endeavor to mitigate this problem by earnestly encouraging their loved ones to consume more food, often offering favorite comfort foods or supplementing meals with nutrient-dense protein drinks. However, if the weight continues its relentless decline, despite these sincere and often exhaustive efforts, it becomes imperative to acknowledge that the underlying issue transcends mere dietary habits. It is the body itself embarking upon a deeper, more profound transition. At this sensitive and critical stage, attempting to force large meals may prove counterproductive or even distressing. Instead, a more compassionate and effective approach shifts towards prioritizing comfort, offering easily digestible, appealing foods, and ensuring consistent hydration, all of which can make a more significant contribution to maintaining the individual's remaining quality of life. If you observe significant and persistent weight loss in an elderly loved one, particularly if it is accompanied by reduced eating, increased feelings of weakness, or a struggle to remain active, it is a crucial moment to pay meticulous attention. This observation is not merely about alterations in physical appearance. It represents the body unequivocally sending a profound message, and understanding that message now can prepare you for the challenging road ahead with enhanced clarity, profound compassion, and the invaluable capacity to render every remaining moment deeply meaningful and cherished. Following closely on the heels of weight loss, one of the most profoundly noticeable and pervasive changes in the year preceding the end of life is the onset of an extreme, deep-seated, and utterly relentless fatigue that fundamentally resists alleviation through conventional rest. This is not simply the feeling of being a little tired after a particularly demanding day. Rather, it is a profound, debilitating exhaustion that renders even the most rudimentary, simple tasks utterly overwhelming and seemingly insurmountable. The act of merely getting out of bed transforms into an arduous challenge. Walking across a familiar room demands immense, concentrated effort, and activities that were once routine, such as preparing a meal, dressing oneself, or even sustaining a coherent conversation, begin to feel utterly draining and impossible to maintain. This level of exhaustion is far more than a mere byproduct of advanced age. It serves as a clear, unmistakable signal that the body is systematically conserving its dwindling remaining energy reserves. As the function of vital organs progressively slows, the body begins an instinctive and necessary process of prioritizing what is most absolutely essential for basic survival. The heart, for instance, does not pump blood with the same former efficiency. The circulatory system weakens, and muscles no longer receive the optimal level of oxygen and nutrients they once enjoyed. This complex physiological recalibration is precisely why many elderly individuals in their final months often feel a pervasive sense of weakness, become increasingly unsteady, and find themselves fundamentally unable to sustain the level of activity they once readily enjoyed. Another pivotal factor contributing to this profound fatigue is a significant metabolic slowdown. The human body is inherently designed to produce and efficiently utilize energy, but as it prepares for its ultimate final phase, that precious energy is strategically redirected. Instead of being channeled into fueling robust movement and active engagement, the body deliberately shifts its resources towards critical preservation. This fundamental change is why someone experiencing this decline may begin to sleep for significantly longer periods, requiring more frequent and extended naps throughout the day, and finding it increasingly difficult to remain awake and alert for sustained intervals. Some individuals may even experience abrupt, precipitous drops in energy, where they appear relatively fine one moment, but become utterly drained and unresponsive the very next. Perhaps the most poignant and heartbreaking dimension of this process is the profound emotional impact of such relentless fatigue. Many seniors who once took immense pride in their hard-won independence and self-sufficiency begin to feel deeply frustrated or even overtly embarrassed by their inability to perform tasks they once accomplished with ease. They may increasingly withdraw from social conversations, actively avoid social interactions, or cease engaging in cherished hobbies, not because they have lost interest or affection, but because they simply lack the requisite physical and mental energy. This can tragically lead to a vicious cycle of isolation, where they eventually stop trying altogether, a disengagement that only serves to accelerate their overall decline. For families who are observing a loved one transition from a vibrant, active, and engaged individual to one who is consistently exhausted and withdrawn, the experience can be agonizingly painful. It is often tempting to fall into the trap of assuming they are merely being lazy, or that they simply need to push through their fatigue with greater effort. However, the profound reality is that attempting to force increased activity will not only be ineffective but potentially detrimental. What truly matters most during this period is to deeply understand their physical and mental limits, to graciously allow them the rest they inherently need, and meticulously structure their remaining days in a manner that maximizes their comfort and sense of ease. If you observe a loved one experiencing this deep, pervasive, and ongoing fatigue that is stubbornly unrelieved by rest, interpret it as a definitive sign that their body is undergoing a major, profound transition. This is the sacred time to cherish every conversation, to deliberately create moments of profound peace and tranquility, and to offer unwavering support without imposing expectations or demands, because, in the ultimate analysis, what truly matters most is not how much they are physically capable of doing, but that they feel unequivocally loved, deeply understood, and utterly at ease in their final journey. As an individual draws nearer to the final delicate stage of life, one of the most striking and emotionally challenging changes to observe can be a marked increase in cognitive confusion or a significant emotional withdrawal from their environment and loved ones. You might begin to notice that someone who was once renowned for their sharp intellect and engaging conversational abilities starts to exhibit more frequent instances of forgetfulness, struggles noticeably to follow the thread of complex conversations, or appears disoriented and perplexed, even in once familiar surroundings. They may find themselves repeating the same stories or questions multiple times within a short period, forgetting the names of close acquaintances or even family members, or losing track of the day, date, or time, even if they had no prior history of memory issues. These subtle yet progressive cognitive shifts can emerge months or even a full year before the ultimate passing. This is not merely the everyday forgetfulness commonly associated with normal aging. It signals a deeper, more systemic issue. The brain, much like any other vital organ, demands a consistent and robust flow of oxygen and essential nutrients to function optimally. However, as the body's overall circulation weakens and the consistent supply of oxygen to the brain incrementally decreases, cognitive function inevitably begins its decline. The person may become easily confused by new information or complex situations, experience significant difficulty in making even routine decisions, or struggle to recognize the faces of people and places they have intimately known for decades. In some particularly poignant cases, they may experience fleeting moments of remarkable lucidity, where their clarity of thought briefly returns, only to be followed by sudden, disorienting episodes of profound confusion, almost as if their mind is gently fading in and out of comprehension. Another frequently observed and profoundly impactful sign is a noticeable emotional withdrawal. Someone nearing the culmination of life often progressively loses interest in social interactions and external stimuli. You might perceive them speaking less frequently, engaging less actively in discussions, or spending extended periods simply sitting in quiet, introspective silence, appearing distant. It is crucial to understand that this is rarely an indication that they no longer care about their loved ones. Rather, it signifies that their brain is no longer processing emotions, social cues, and external engagement in the same way it once did. Conversations become increasingly tiring, noisy or bustling environments feel overwhelmingly stimulating, and eventually, many seniors intuitively retreat into their own internal world, a sanctuary of quiet reflection. You may also observe pronounced changes in their mood and overall behavior. Some individuals may become more irritable, anxious, or easily frustrated by minor inconveniences, exhibiting a decreased tolerance for stimuli. Conversely, others might appear unusually calm, profoundly detached, or even seemingly indifferent to matters that once held significant importance and personal meaning for them. This is not simply a shift in personality. It is frequently a direct consequence of the brain adapting to the body's comprehensive decline. As cognitive function progressively slows, emotions become increasingly challenging to articulate or express, and the person may cease to react to situations in the familiar ways they once did. For family members, this particular stage can be exceptionally difficult and emotionally taxing. Witnessing a loved one lose touch with reality or emotionally withdraw can evoke a painful sense of anticipatory grief, feeling as though you are losing them even before their physical departure. However, it is paramount to remember that these changes are not within their conscious control or volition. Instead of attempting to force them back into active conversations or demand their full attention, the most compassionate and effective approach is to meet them precisely where they are in that moment. Speak gently, offer reassuring words and a comforting presence, and understand that even if they do not always verbally respond, they can profoundly feel your love and unwavering presence. If a loved one exhibits increasing forgetfulness, appears more frequently confused, or becomes significantly less engaged with their surroundings, do not disregard these observations. These are often early, crucial signs that both the body and the mind are embarking upon their preparation for the final transition. This is a time for immense patience, for cherishing quiet, unspoken moments, and for diligently focusing on cultivating an environment that feels profoundly safe, comforting, familiar, and utterly peaceful. Because even when the capacity for words and complex communication fades, the profound power of love, comfort, and gentle presence can still be deeply felt and profoundly appreciated. As the human body commences its gradual winding down process, one of the most unambiguous and physically evident signs that emerges is a markedly weakened immune system, rendering the individual increasingly susceptible to illness. You might begin to observe that someone who historically rarely fell ill now appears to contract every passing cold, every strain of flu, and every minor infection that circulates within their environment. What were once considered minor fleeting illnesses now require considerably longer periods for recovery, and simple wounds such as a small cut, an abrasion, or a minor bruise heal at a noticeably slower and less efficient rate than they once did. These physiological changes are by no means random occurrences. They serve as clear, irrefutable indicators that the body is no longer capable of defending itself or repairing its tissues with the same robust efficacy it once possessed. One of the most significant and pressing concerns at this stage is the heightened frequency of recurrent infections. Conditions such as pneumonia, urinary tract infections, UTIs, various skin infections, and even oral infections become disturbingly more commonplace as the immune system's protective capacities wane. Many families instinctively assume these are merely isolated, unconnected illnesses, but when they begin to occur with alarming frequency or necessitate an extended duration to fully resolve, it is often a critical sign that the body is progressively losing its inherent ability to effectively fight back against pathogens. Even antibiotics, which once yielded swift and effective results, may appear noticeably less potent, often requiring stronger formulations, more prolonged courses of treatment, or multiple rounds of medication for infections that would previously have been considered minor and easily manageable. This diminished responsiveness occurs because as overall circulation slows and vital organ function declines, the body simply cannot respond to treatment with the same vigor or efficiency. Another often overlooked but significant issue is the presence of chronic non-healing wounds. If you notice that small scratches, persistent sores, or bruises are failing to heal properly, or frequently reopening, it could signify that the body's circulation is severely compromised. Inadequate blood flow translates directly to insufficient oxygen and nutrient delivery to the skin and underlying tissues, rendering the healing process significantly slower and more difficult than normal. Pressure sores, particularly for individuals who are increasingly less mobile or bedridden, become a severe and life-threatening risk, capable of leading to dangerous systemic infections if not meticulously managed and proactively prevented. What is even more concerning is that infections occurring in the final year of life often do not present with the typical expected symptoms. Instead of exhibiting a high fever, an elderly person may simply appear more tired than usual, exhibit increased confusion, or show a diminished interest in eating. In fact, for seniors, a sudden, inexplicable decline in mental alertness or cognitive function is frequently the very first warning sign of an underlying infection, often preceding the appearance of other more overt physical symptoms. This is precisely why recognizing these subtle yet critical changes early on can make an immense difference in the level of comfort, dignity, and supportive care they receive during their final stage of life. For family members observing a loved one endure repeated infections, the experience can be profoundly frustrating and heartbreaking. There is a natural inclination to advocate for aggressive treatments, clinging to the hope that one more round of antibiotics or one additional hospital stay will miraculously resolve the problem. However, at a certain critical juncture, the focus often compassionately shifts from the objective of curing to the profound importance of comforting. Ensuring they remain adequately hydrated, maintaining immaculate skin hygiene to prevent breakdown, and minimizing unnecessary stress on the body can often do far more for their overall well-being and peace than another round of medication that might only prolong suffering without meaningful benefit. Finally, one of the most profoundly telling and physically discernible signs that the body is indeed preparing for its ultimate final stage is the manifestation of major and noticeable changes in both breathing patterns and circulation. You might begin to observe that your loved one's breathing becomes distinctly slower or more shallow than it previously was. At various times, they might exhibit noticeable pauses between breaths, or their respiration could become markedly irregular, unexpectedly speeding up for a period before gradually slowing down again. Some individuals may experience a specific, gentle yet distinctly rhythmic breathing pattern, known as Cheney-Stokes respiration, characterized by an alternation between periods of deep, rapid breaths and longer, sometimes unnervingly prolonged pauses. These breathing alterations can commence subtly, almost imperceptibly, but over time they progressively become more pronounced, more frequent, and more overt. Another very common and crucial sign is a noticeable weakening of the circulatory system. You may observe that their hands, feet, or even extremities like their nose and ears begin to feel consistently cold to the touch, indicating reduced blood flow. The skin itself may take on a pale, bluish, or mottled appearance, particularly around the fingers and toes, a condition known as cyanosis. This phenomenon occurs because the body is instinctively prioritizing the allocation of blood flow to its most vital internal organs, concurrently reducing circulation to the extremities. It serves as a clear physiological indication that the heart is no longer pumping with the same strength or efficiency as it once did. Some individuals also experience an increased degree of shortness of breath, or dyspnea, even with minimal physical exertion or movement. Simply sitting up, speaking a few sentences, or even subtly shifting positions in bed might cause them to feel significantly winded or gasping for air. You might observe them breathing through their mouth more often, or they may suddenly need to pause and catch their breath in the middle of a conversation. If they were once capable of walking across a room with relative ease but now struggle intensely to do so, it is a strong indicator that their overall lung function may be significantly declining. In certain cases, the accumulation of fluid in the lungs, a condition known as pulmonary edema, can make breathing even more arduous and distressing. This can manifest as a persistent cough, gurgling, or rattling sounds in the chest, often referred to as a death rattle, or even a subjective feeling of tightness or pressure in the chest. Many people mistakenly assume these symptoms are merely congestion from a common cold or flu, but in elderly individuals nearing the end of life, it is frequently a critical sign that the lungs are weakening and struggling. This fluid buildup can make lying flat utterly uncomfortable, and they may instinctively prefer to sleep propped up on multiple pillows or in a recliner to alleviate their breathing difficulties. For family members, witnessing these profound physiological changes can be deeply frightening and anxiety-inducing. It is entirely natural to instinctively want to help, to encourage them to take deeper breaths, or to worry intensely that something urgently catastrophic is happening. However, in many instances, these manifestations are simply the body's inherent natural way of slowing down and preparing for its final rest. There may not always be a viable medical intervention to reverse these changes, but there are certainly compassionate ways to enhance their comfort. Maintaining a cool room temperature, utilizing a humidifier to moisten the air, or offering small, frequent sips of water can significantly help to ease their discomfort. In some specific cases, carefully prescribed medications or supplemental oxygen therapy can provide a measure of relief, but the primary focus unequivocally shifts towards comfort rather than attempting to rectify or cure the underlying issue. If you observe these specific signs, pronounced changes in breathing patterns, consistently cold hands and feet, or a bluish tint to the skin, it is imperative to pay close attention. These are often powerful indicators that the body is systematically conserving its remaining energy and that its vital circulation is progressively slowing down. This is a crucial time to be deeply present, to offer unwavering reassurance, and to diligently create a peaceful, tranquil environment where they feel profoundly safe, loved, and utterly at ease. In these final months or weeks of life, the most important gift you can offer them is not necessarily aggressive medical intervention, but rather an abundance of comfort, an unwavering preservation of their dignity, and the profound, reassuring knowledge that they are not alone in their journey. As we reach the conclusion of this extensive discussion, it is imperative to take a thoughtful moment to reflect upon the critical insights we have explored. The 5 key signs, significant and unintentional weight loss, pervasive and extreme fatigue, increased cognitive confusion or emotional withdrawal, frequent and recurring infections coupled with slow healing, and major changes in breathing patterns or circulation, are profound indicators that often manifest in the year leading up to an elderly person's passing. It is important to remember that these signs may not all appear simultaneously, nor are they always immediately obvious or dramatic at first glance. However, when you begin to notice a constellation of these changes occurring, it serves as a powerful and unequivocal signal that the body is entering its profound and final transition. For many families, coming to terms with these changes can be an extraordinarily difficult and emotionally arduous process. It is a natural human inclination to want to fiercely fight against these declines, to earnestly encourage a loved one to eat more, to move more vigorously, or to simply push through their debilitating exhaustion. Yet sometimes the most compassionate and effective course of action we can take is to humbly listen to what their body is so clearly communicating. Instead of channeling our energies into a futile attempt to reverse what is, in many instances, an inevitable process, we can redirect our focus towards making the remaining time as peaceful, comfortable, and profoundly meaningful as humanly possible. Understanding these vital signs is not about succumbing to fear of death. Rather, it is about being adequately prepared for its natural progression. When you are equipped to recognize these profound changes early, you gain the invaluable capacity to offer significantly better care, to make crucial decisions with foresight and clarity, and to ultimately ensure that your loved one's final months are suffused with unwavering love, profound respect, and the preservation of their inherent dignity. This precious period becomes a sacred time for cherishing moments, for sharing heartfelt stories and memories, and for unequivocally letting them know that they are deeply valued, profoundly loved, and never, ever alone in their journey. If you are currently observing these complex signs in someone deeply close to you, we urge you to take a deep, calming breath and remember that you are not isolated in this challenging journey. Countless families have navigated this path before you, and while it is undeniably never easy, possessing the knowledge of what to expect can empower you to discover profound reservoirs of strength, cultivate boundless patience, and ultimately find a serene sense of peace amidst the difficulties.